Everyone, we'll call to order the Clay County Board of Commissioners meeting Tuesday, April 14th. Is there, I'd ask, is there approval of the agenda?
Mr. Chair, I'll make a motion to approve the agenda.
Second.
We have a motion and a second. Any other discussion? Any other discussion? All in favor say aye.
Aye.
Moving on, we have a couple employee recognitions. First, we'll go with Laura Jones.
Laura's not here.
Okay, I didn't see her, so I didn't know if she was out there. Yeah,
Say a few words for
yeah,
her.
please.
Laura's my front office executive and worker up there. She's been in the office for 25 years along with me, and she's done a terrific job. She was a legal assistant for years for me before that, but she's the person that takes care of everything at the front desk and handles all the people that come in and always have issues, and she's just terrific at handling personnel and managing the office. So she does a great job for us. She happens to be ill today, but I'll take her plaque for her and give it to her. So thank you.
Thank you for that, Brian, and thank you, Laura. Now, Sherry Rothfeld? Okay, thank you. And thank you for your service for the last 15 years.
Yes.
I appreciate it. The board thanks you, and we have a few words to be said.
We do. So today we're here to celebrate Sherry and her kind of 15 years with Clay County, because truth be told, she's been here a little bit longer. She didn't start just 15 years ago with Clay County. She originally worked in the child support unit back in 1991. That was when we had fax machines as cutting edge technology. We had computer screens that were 2 feet deep on your desktop. And our case files were legal size lime green things, and they looked really great with the orange cubicle walls and chairs that we had in our very 1970s designed office space. After a few years, she moved to the sheriff's office, where she also worked in office support. And then she stayed there until 1997, when she moved on to explore some other opportunities. I couldn't confirm the dates, but between the two of us, those are the dates we kind of figured on. Like all great stories, she did come back to Clay County in 2011. She returned to Clay County, and we just kind of decided that once you're a part of this place, we don't really let you go. She currently works as a child support aide in our child support unit. She handles outgoing interstate cases. And this is always an interesting caseload. It's got multiple clients with custodial and non-custodial parents. Now you throw in another state, you might throw in another employer. You could also throw in some other countries. We work in other time zones. There's a lot to it. But what really stands out about Sherry isn't just the complexity of her work, it's how she does it. Sherry really wants to help people, and her customer service skills are outstanding. She works really hard to get answers for people, to get back to them by following up with phone calls or letters, whatever she needs to do. She wants to keep clients informed on how their case is going. And somehow, through all that, she manages to stay positive and upbeat all the time, which in this job is no small thing. So, Sherry, we're really glad you came back to Clay County and celebrating your 15 years plus of employment.
Well, thank you. I'm very excited about it. Thanks.
Thank you. So do we have any citizens to be heard this morning? Seeing none in the audience. Anybody online, Darren?
No, Mr. Chair.
All right, thank you. We'll move on to the approval of payments and bills and vouchers.
Mr. Chair, I move to approve the payment of bills and vouchers.
Second.
We have a motion and a second. Is there any other discussion? Any other discussion? Hearing none, all in favor, say aye.
Aye.
Anybody opposed? Motion passes. On to our second agenda item, annual department update of social services, home and community-based services, and licensing and disability services division. That's a mouthful.
Thank you, Mr. Chair. Good morning. I am, again, going to talk very little today. I'm going to let Holly and Mary do all of the talking for social services today. They're going to give you an overview of licensing and disability, as well as home and community-based services division. So,
Hi, my name is Mary Koskanimi. I am the supervisor of the Licensing and Disability Services Division at Clay County Social Services. I am new to this role. I took over the opening left by Jessica Mickelson in December of 2025. Prior to moving into this role, I was a MnChoice's reassessor for about 5 years, and prior to that, I did ongoing case management in the Child Protection Division for 5 years. I've been with the county now for about 10 years. My division here is a unique one because we have two very different program areas. We have the licensing side, which you see is the licensors, and then we have our disability services side, which is the MnChoice's staff, our intake staff, and our case aid. There's not much crossover in our day-to-day work between these program areas, so with me having background experience in the disability services, licensing has been an area that I've been working hard to learn. Lucky for us, Clay County has a team of amazing licensors who have a wealth of knowledge in their program areas, and they've been wonderful to work with as I get my feet under me. I'm excited to show you the work that we've done in 2025. To start off, I would like to review the adult and corporate foster care licensed homes. This area, we have one full-time licensor, Fran Davenport, and 2 other licensors who assist with a smaller caseload. In Clay County, we have 2 different types of licensed home for our 245D clients. The first one is the family adult foster care. This is a setting where the home is licensed and then the family or individual living there opens their home to share with the client. This is most often thought of when thinking about an adult foster home. The next setting is a corporate foster care home, and this is a setting where the home is licensed by an agency, and then shift staff will come into the home to provide care. The caregivers do not live full-time in the home with the client in this setting. This is what's most often thought of when you think of a group home setting. These types of homes can be licensed for both adult and children. So looking closer at our family adult foster care, which is the blue box, in 2025, we had 57 licensed homes with a total of 101 beds. Clay County does now have 10 open beds, and there's 1 application that's currently in process. In 2025, we had 3 of these types of licensed homes that were closed, 2 voluntarily and 1 that was revoked. I feel that's important to highlight that there has been a reduction in licensing actions with only 1 revocation in 2025. Overall compliance issues in Clay County have dropped considerably. This shows the work that Fran Davenport has put into the development of new providers and education and oversight to our currently licensed homes so all can have efficient programs and are compliant with statute. When it comes to the process of opening a new family adult foster care home, Clay County continues to develop new licensed home on a needs-based system. We are working from a wait list and matching providers with persons served. All new licenses since 2023 have had identified service recipients prior to licensure. There are currently 130 names of potential license holders on the waitlist. The waitlist questionnaire allows us to vet potential applicants for regulatory guidelines and then match providers' skills and homes with service recipients. We have had success through 2024 and 2025 using this new updated licensing process. It is more person-centered, involving the service recipients and their care team, giving them more control over where they live and who their caregivers are. And we have also noticed that there's a more vested interest in the success of the placement. Looking closer at our adult and child corporate foster care homes, which would be the green box, you may see this type of home shortened to CRS, which stands for Corporate Residential Settings. In 2025, Clay County had 121 CRS homes licensed, with 333 total beds. 323 were for adults, and we had 10 of those beds for children. There were 4 new CRS homes opened in 2025. To put on your radar, there is new licensing fees for the adult and corporate foster care licenses that is rolling out in 2026. There will now be an annual renewal fee of $2,100 for providers. 50% of this fee will be directed to the county, and this will contribute nearly $200,000 in revenue for Clay County this year. We do anticipate some closures because of some legislative changes, but because of the implementation of the waitlist in 2023, we do not anticipate a negative impact of resources or on persons served. Now, looking at our child foster care homes, so the orange box, these are the homes that we have licensed to provide care for our children who are placed through Child Protection Services or through court orders. Our unit is set up that we have 2 licensors that manage this type of setting, Gail Burnside, who will license our non-relative homes, so homes that you typically think of when you think of a foster home, and Alex Isog, who license our relative homes. These are homes that are licensed for a specific child or a specific family. We currently have 51 child foster care homes licensed. Of these homes, 32 are non-relative homes with 7 applications currently in process, and 19 are relative homes with 11 applications currently in process. 2 of these relative homes will take non-relative placements if needed. I wanted to highlight this last year that we have had more foster homes come forward and provide respite care through the Children's Mental Health Grant for children that are not currently in placement. These children are some of the more significant mental health needs and are typically older children. This gives us hope that there might be more of our foster families that may be more comfortable to take older children for full-time placements in the future, which is always a need for our community. Speaking of areas of need for our community, let's look at the family child care licensors and what they've done in 2025. So we have 2 licensors that specialize in this program area. We have Karen Helm and Julie Clear. They currently have 121 child care licensed providers. At this point in time, there are 10 applications in process, and in 2025, we had a total of 21 applications for new providers. This is down 6 from last year due to retirement, change in careers, or other health factors, but we did have 3 providers who have returned to be licensed again after they have closed their in-home daycares. Family child care is an area that we are actively recruiting providers. These efforts look like attending community events, distributing marketing and promotional materials. We provide ARPA-supported incentives, such as bonuses for specialized license that would help cover a need for the community. There's a mentor program to help support new providers, and we provide free trainings for our providers. Even through our efforts, there continues to be a need for additional childcare providers in our community. This brings us to the other side of our division, so our disability services. Our disability services process starts with our adult and disability intake workers. We have 1 full-time intake worker, Bria Kraus, and then 1 who is half intake and half MnChoices assessor, Kylie Kolstad. Our intake line provides coverage for all 3 adult units in Clay County, so behavioral health, home and community-based services, and licensing and disability services. This requires the workers to have a vast understanding of county services, including but not limited to the MnChoices process, civil commitments, MARC reports, waiver programs, CFSS services, as well as being able to understand the community resources that may meet the needs outside of the county. In 2025, our intake worker documented 1,121 intakes. This number is not the complete picture, however, because there are phone calls that happen where callers refuse to provide names, or they're quick questions that just need a resource. Intakes can be in person or over the phone, and a typical intake that leads to a MnChoices referral can take up to an hour to gather all information needed. Our intake process does go through and collect information to ensure that the request being made is appropriate for county services. If it's not, our intake worker may provide resources to the caller to other community programs, such as mental health services, housing supports, or food banks. Our intake workers do their best to help the callers be pointed in the right direction if their need is not going to be met going through the MnChoices process. The gateway to all disability services is for an individual to complete a MnChoices assessment. But what is a MnChoices assessment? This is a comprehensive interview conducted by a certified assessor. The goal of a MnChoices is to make sure that a person gets the right level and type of support to live as safely and independently as possible. These assessments are completed in person, typically where the person resides, and they aim to identify needs by gathering an understanding of the person's health conditions, daily living challenges, cognitive behavioral needs, and safety risks for the individual. It'll determine eligibility by showing if a person qualifies for programs like the home and community-based service waivers or the CFSS program, as well as aging programs for our 65-plus community. The MnChoices supports person-centered planning by having a focus on what the individual wants, as where they want to live, how they want to live, and what supports they feel could help them stay independent. It serves as a guide for service planning. It provides the foundation for support plans by identifying assessed needs. If a person was to open a program, the type of services that can be approved must be justified by the assessed need showed by MnChoices. For example, a case manager would not approve the service of like home-delivered meals if the information gathered in MnChoices was that the person loved to cook and had no issues providing meals for themselves. The MnChoices and the future support plan need to go hand in hand. And finally, the MnChoices tool ensures fair and consistent decisions. This is a standardized process across all of Minnesota, so people are evaluated consistently and are connected to the appropriate resources. In 2025, we had 6.5 full-time MnChoices certified assessors in social services. In Clay County, we have our workloads divided up by initial assessments and reassessments. This is due to the different workflow, the focus of the meeting, and the timelines that are required. Clay County Social Services MnChoices team works as a well-oiled machine with meeting those timelines and providing thorough documentation to case managers. In the start of 2026, we did have a shift that brought 2 initial assessors and 1 case aide from public health to social services. This has been a great transition with having all the initial assessors in 1 unit for consistency with documentation and for coordination. If we look specifically at the work of the initial assessors completed in 2025, they were able to complete 536 assessments. This initial assessment main focus is to gather the information that determines eligibility for programs such as waivered services or CFSS. If you wonder who can have a MnChoices assessment, a MnChoices assessment can be done for anyone in Minnesota who may need long-term services and supports, such as people who are over the age of 65, people with disabilities, individuals with mental health needs, and people that are struggling with their daily activities. We do track some of these areas that are initially identified in the intake. So as you can see on the chart, that our 2 main areas of need last year were mental health related and developmental disabilities. Once a person opens to a program, they need to complete a MnChoices reassessment annually. This is frontline fraud, waste, and abuse screening. A MnChoices reassessment is ensuring that the level of services remains to be the most appropriate, that there are no new assessed needs that need to be met, and that the program and services that are being utilized as they should be. It's important that our reassessors have a manageable caseload to be able to complete thorough reassessments, and each time an individual is approved for services from the initial assessment, the number of reassessment grows. More often than not, an individual will stay on a waiver services for multiple years, but there may be a decrease in caseload, for example, if an individual moves out of the county or if they pass away. In 2025, we did add a 4th reassessor to help bring that caseload back down to more of a manageable range, which is that 14 to 18 reassessments a month. Our biggest transition in 2025 had to be rolling out the Community First Services and Supports Program, or CFSS, which the rollout started in October of 2024. This is the program that replaced personal care attendants, so PCA, and community support grants, CSG. The intent of this new program was to allow for individuals to have more choices and control over the services that they receive, but this transition has not been as smooth as we could have hoped. One of the new aspects of CFSS services is that the individual needs to work with a separate agency to provide consultation services. These consultation service providers are required to meet with the individual and create a service delivery plan prior to the county being able to approve services in the home. This added step has become a barrier in the process. In the state of Minnesota, there are about 57,000 individuals that are currently utilizing CFSS or PCA, and at this time, there are only 16 consultation service provider agencies. In October of 2025, only 7 of those were taking new referrals. The lack of service providers leads to delays, confusion, and service gaps. There's also been a shift in the process in the administrative responsibility to the MnChoices assessors as they assist and track individuals going through to open on this program. Much of these responsibilities mimic the role of a case manager, but an individual on CFSS does not have an assigned case manager, so these tasks of coordination and additional documentation then falls on the MnChoices assessors, which adds additional tasks to their plates. This program continues to grow in Clay County. In 2025, 41% of all initial assessments that were completed were approved to be open to CFSS. If all individuals follow through with the process of onboarding, that would add 155 new CFSS clients in Clay County. Again, this program requires annual reassessments to be completed. So in 2025, this averaged about 29.5 reassessments a month just for CFSS clients. As we continue to open new CFSS clients, that number of reassessments are expected to climb as well. In conclusion, our Licensing and Disability Services Division continues to stay up to date with statutory changes. We continue to support current licensed providers as well, making recruiting efforts to fill community needs. We continue to assist community members to be connected to the correct resources, and we continue to complete timely and thorough assessments and open the doors for disability services and review and ensure that services are being used appropriately and an individual's needs are being met. I am proud to take over the role of supervisor in this division, and I look forward to the work that we can do in 2026.
All right, good morning. I'm Holly Wanner, and I supervise our home and community-based disability services here in Clay County. So kind of following up from Mary's discussion about MnChoice's assessments, once a person has had a MnChoice's assessment, if they are determined eligible for a home and community-based disability waiver program or Rule 185 case management, they are assigned a case manager in my unit. And case managers serve people of all ages with a disability and who are eligible for Medicaid waiver or Rule 185 developmental disabilities case management. Case managers provide services to people and their families, focusing on person-centered planning, referrals, support plan monitoring, coordination, and advocacy related to waiver services or other community resources. And as you'll recall, in the 2026 budget, we did add a new case management position for my division. So that brings us to 15 case managers who oversee our home and community-based disability waiver programs or that Rule 185 case management. In addition to my 15 case managers, I have 2 case aides who assist case managers with administrative activities related to our disability waivers and our Rule 185 case management. So they really are the glue to what case managers are doing in my unit. They're the ones doing all the filing, helping case managers track meetings, appointments, or scheduling those, as well as entering services into our system to authorize the disability waiver programs. So taking a little bit deeper dive into our home and community-based disability waivers. So each disability waiver requires the person to be a Minnesota resident. They need to be on Medicaid, have a disability and be certified disabled, have a need for a service as an alternative to living in an institution, and then each waiver does have additional individual waiver requirements, including a level of care. Ultimately, our disability waivers fund services to help a person live as independently as possible in a community setting, promote optimal health, independence, safety, and community integration. So in the state of Minnesota, we have 4 disability waiver types. Our first waiver type is our brain injury waiver, and this really is focused for people diagnosed with a brain injury who require a level of care provided in a specialized nursing facility or a neurobehavioral hospital. In 2025, we served about 4 people under this program. Our next waiver is our most commonly used waiver, and this is our Community Access for Disability Inclusion, or our CADDY waiver. And this is for people with disabilities who require the level of care provided in a nursing facility. And in 2025, we served 578 people under this program. Our next waiver is our Community Alternative Care, or our CAC waiver, and this is for people who are chronically ill or medically fragile and require the level of care provided in a hospital. In 2025, we had 10 consumers under this program. And this is a bit of a unique program, how we administer it in Clay County, because we work very closely with our public health department. Our public health nurses are the primary case managers for these individuals just due to the medical complexities of the people that are being served. In addition to that, we do have a secondary case manager assigned in social services to help with some of the administrative tasks related to this. And then lastly, our last disability waiver is our developmental disabilities waiver, which is for people diagnosed with a developmental disability or related condition. And the level of care for this program is intermediate care facilities. So last year, we served 210 people under this program. This next slide just kind of highlights the overall funding that we are administering through our disability waiver program. So as you can see, we manage around $100 million a year in waiver-funded service supporting individuals in the community. In the last slide, or the last area there, you'll see for 2026, there is a bit of dip in the overall services that were projected to allocate this year, but that really doesn't reflect the demand for the service. This is really probably only reflective of a couple months of service authorization or projected service authorization for this year. As we add people to our waiver programs for 2026, we'll continue to see that number grow and be closer to that 100 million. So this slide really also just kind of highlights the importance of having manageable caseloads to make appropriate decisions. We want our case managers to be able to thoroughly monitor services that are being authorized, the intensity level, and the frequency of the service so that we are assuring they're meeting the person's needs. So in addition to our disability waiver programs, we do have some other case management programs in my division. One is that Rule 185 or developmental disability case management. And last year we served about 115 individuals. Under this case management, there are some other service options. So the Rule 185 or developmental disabilities case management is county-funded case management, and it's for individuals with a developmental disability or related condition. Under this area, we served 9 people who were eligible for a statewide cash grant, which is the Family Support Grant. And this is for people under the age of 25 to purchase disability-related services or supports. In addition, we served 31 people under our Semi-Independent Living Skills program, or our SILS, and this is a state and county-funded program for people who are 18 and older with a developmental disability or related condition that provides services to help them live successfully in the community. And then lastly, we did have 2 individuals under our county-funded day training and habilitation program, which is for individuals who are 18 or older with a developmental disability, focusing on developing or maintaining life skills. And then lastly, in my unit, we do have another Medicaid-funded program, which is the Relocation Service Coordination, or Move Home Minnesota. And in 2025, we served 11 people under this program, which is a Medicaid-funded case management for people in Minnesota who are in an eligible institution and are looking to relocate back into the community. So an example would be if someone has been in the nursing home maybe following a stroke, and they would like to return to their home or back into the community. The case manager will work with them closely to set up the services that they need to successfully move back home or maybe move into an assisted living facility without there being any gaps of services, so they can immediately discharge into that program. In addition, we do what's called contracted case management, and this is a case management service delivered by a private agency under a formal agreement with a lead agency. In Clay County, we do contracted case management exclusively for individuals under a disability waiver. We currently maintain contracts with 4 private agencies for the provision of case management services. And across these 4 agencies, we have a total of about 95 people that are assigned to a contracted case manager. I have one case manager in my unit who majority of her caseload are these contracted cases. So she provides that oversight and monitoring of the contracted case managers to ensure that they are meeting all of the rules and regulations of the program. So next, I just kind of wanted to highlight our average caseload size for the last few years. As you can see, in 2022, we had an average of 59 cases per case manager, and at that time, we had 11 case managers. In 2023, that bumped up a bit to 62 cases on average, and we did add 3 additional case managers that year, so bringing it up to 14 case managers. And then in '24 and in '25, our average caseload size stayed about the same at 65. And we are trending as well this year around 65 cases per case manager. So just kind of in addition to that, as caseloads increase, we also are seeing changes within our caseload and the needs of our cases. So the complexity of the population we serve continues to increase, as well as, Mary talked a bit about the requirements of CFSS, which also, when that program is authorized under a disability waiver, those responsibilities do fall on to the disability case manager to oversee and authorize. And then when someone does go on a waiver, they do need to access a waiver service within 60 days of starting the waiver, or we need to exit them. So case managers are working diligently to get services set up for individuals so that we are avoiding them having to exit off the waiver and then start the process over. All right, so a couple initiatives or challenges within our my unit in the last year. So last July, on July 1st, the Disability Services Division in Minnesota authorized a new policy, which is the Residential Support Services Criteria. This is criteria that indicates a person needs to meet certain requirements to access customized living or community residential services. Ultimately, the case managers need to present all other service options to these individuals to ensure that they have informed choice and that they are aware of all the resources available to meet their needs outside of moving into one of these settings. In addition to that, this board is familiar with our lead agency capacity building grant with the Department of Human Services to increase competitive integrated employment for people with disabilities. So this last fall, my case managers completed a series of training focusing on our employment services. And then through that training, they've grown their skills in being able to have targeted employment conversations with people on their caseload. And we, in return, have increased service authorizations for 2 of our waiver services that focus primarily on helping people explore employment. So that certainly was a really positive outcome of this grant, and we will continue to move forward in that area. In addition, we did also meet another area of our grant, including completing all the training and increasing case managers' knowledge around employment services. So we will continue to work through this grant through this next grant cycle. So we'll start a new grant cycle here on July 1st through the next year, focusing on some additional goals that are really targeting increasing these employment services as well as competitive integrated employment for people with disabilities. And then lastly, Waiver Reimagine. So this is a program that was set to launch January 1st of 2027, but it's being delayed as it's needing system updates and DHS capacity to launch this project. Waiver Reimagine is changing the 4 disability waivers into 2, developing individual budgets. So each person will have an individual budget that they will need to work within to authorize their services to meet their needs. It also is expanding self-direction and providing direct access to personal waiver information through a secure portal. So this is being delayed. We don't have any information about tentative launch dates, and so we will just wait for further instruction from DHS. So, any questions for us?
Quinn, can you go back to Mary's slide on regarding this CFSS, please?
Good question.
I'm kind of focusing on the barriers there. And when we talk about there only being 16 providers statewide, how many of them do we have any locally here? Or?
We do not, but this is a service that you can just do over the phone. So we don't have to be in person. It's just but no, we don't have any that are local.
But you mentioned that before they qualify for other they have to go through that. Did I hear you correctly?
Before we can put CFSS services in the home, they have to work with a consultation. So there has to be a plan created with that consultation services that's approved by the county. We're not able to approve these hours that they show that they're eligible for through the admin choices until we have that plan approved.
And because of that barrier, is there a significant waiting time period then before those services can be provided in home?
If it's a new assessment, there is, yes. If they were previously on PCA or CSG, we are able to approve those services to continue until we can open up to CFSS. Or if they were on CFSS last year, we can approve the units from last year until we have the new plan. But if they are a brand new, an individual going in to do new services, there is a wait, a long wait for them to be able to get services in the home.
So I'm still a little confused on this. So this program, does it enhance something for the people that they couldn't have before? Or, I mean, is it a whole new, I hope you catch what I'm saying here. Is this an enhancement to more services, or is it a piece that they had before, but now they have to qualify in a new way?
So it is very similar to if you were previously on PCA or CSG. There's only a few more steps, so it feels like there's more steps to take to get essentially the same services, but there is new options. So in the past, if you were on PCA, you were only able to use that service for like a person to come into your home, and that's all they can do. Now, if you have CFSS, you can have someone come into your home, but you can also use those units to maybe purchase some goods or services. So say maybe you need a new lift chair and when you don't have a service provider or a caregiver in your home, now we can use those units that could also be used for caregiver to also be for goods and services. So there's new things that can be done with CFSS, but it feels very familiar and the same to people that we're currently using services, minus this consultation service piece of it. That is just one extra step that was added.
Okay. And then to follow up on Commissioner Campbell's question, is it, if we had someone local, would it make that much difference?
I wouldn't say it would because it is just over the phone. So all of these 16 that we currently have open, they're open for anyone in the state can contact. I will say as well, DHS or DCYF is working on adding more providers. It is a process. They're working with 19 currently to get set up. There is no timeline as when that will be done or if all 19 will follow the process. But hopefully in the future we can get some more of these providers.
And to be clear with that, the consultation service is set up by the state. That's not something that the county sets up. We don't have providers. We utilize those providers, so it's that third-party intermediary.
I see.
One of the ways that we weigh a lot of things, and Holly brought it up in her reporting too, is the number of cases that each person might have. Right. If these 16 people have an enormous amount of applications to go through, or the interviews that they have to go through are significant, then that's not necessarily a good thing either.
No.
It's created a backlog for these folks to get these approved. Yeah.
I did have another question for Holly and her. You mentioned in your slides about the contracted case management services. Do you find that beneficial for us?
I do find it beneficial. Most of these individuals are in the metro area or greater Minnesota, so it eliminates my case managers needing to travel to those areas for their meetings or their face-to-face visits. In addition, those case managers, those contracted case managers are housed in those counties where the person lives generally and are familiar with the resources in that community. So that's huge.
That saves the county a lot of money, right?
It does. And we, while there's some resources online to find a provider that's local to the individual that's maybe living in Hennepin County, there's, as we know in Hennepin County, there's many more resources than that. And so when you have a case manager that's familiar with that area, they will be familiar with all the resources available for that person that my case manager's local here in Clay County won't.
Less windshield time your case managers have to have.
Yes.
And it's my understanding that there's some efforts being done in the state legislature to eliminate that.
Correct.
And I think that's a message that constantly needs to be brought up. I know Commissioner Mojo texted me this morning on that issue. raising that same concern. So it's something that we need to stay on top of. That could be beneficial for.
Mr. Chair, Commissioner Campbell, just to add to that, you're right, there is some legislation right now that is proposing the elimination of the contracted case management. I guess I understand that to a certain extent when they talk about the quality of the oversight that's provided. I think that can be handled at each individual county level. You know, as Holly said, we have one specific case manager that provides phenomenal oversight over our multiple contracted providers and really holds their feet to the fire when it comes to doing what they're supposed to do under those waivers. And again, you know, just looking at preliminarily what it would look like if the state removed contracted case management because of the travel time, we'd be looking at needing to add at least 2 additional case
If I remember it, that's something that does it need to be done once a month? Or how often does that travel have to happen?
So those, under our disability waiver programs, our case managers need to see the person at a minimum twice a year. So depending on the needs of the individual, we might be doing a visit every month. But at a minimum, it's twice a year.
And some of those are significant distances, aren't they?
Correct. So if we're traveling up to St. Louis County, I mean, could very well be a case manager needing to spend the night because of the length of time with travel, and then you tack on like a 2-hour visit. Could make for a very long day.
Well, hopefully we can continue the message that these services are good for counties.
Right.
Thank you.
Yeah, thank you, Commissioner. And I agree. And I think there is, I have hope anyway, they're getting enough information from counties throughout that this is going to be a real, prove the fraud first, is what I would say, before you just say that's where the fraud's coming from.
Mr. Chair, for bringing that up. I know in that legislation, there's also some suggestions for basically a rate study and how the rates for doing this work really impacts kind of service delivery. If the rates are set low, they got one increase in 2015 of 1% in terms of the revenue generated. And since then, it hasn't changed since 2015. So with a rate study potentially increasing those rates, you might see, say, more professional level at the contracted
Yeah.
rider level.
I just want to point out, I mentioned that Commissioner Moser texted me. She happens to be in St. Paul right now. That's why she's not here. She was able to have a little bit of time to listen in on our conversation this morning in the presentations, and just wanted to be clear that we are working on those issues at the state level to try to assure that those case managers can stay in place. So,
Yeah. Thank you very much. Any other questions? I want to thank you. Great presentation. The complexity of your work is like overwhelming. And but obviously you've been at it for a long time. A lot of people are involved, and the number of people you serve is pretty impressive. So I just and congratulations on your new venture. And I hear I follow up with Quinn quite often, but I know things have transitioned very well. So thank you. Thank you, Holly.
Thank you.
Thank you so much.
All right. Well,
Thank you, Mr. Chair. Last Tuesday, we had the public hearing for the deer hunting firearms ordinance. Really appreciate the number of people who either submitted their views to us via the website or came here in person and presented. Next week, we'll be opening it back up for some reconsideration among the committee or the commission, and hopefully we will make some decisions moving towards whatever we need as an ordinance in this region. Thursday the 9th, I had a Beyond the Yellow Ribbon meeting in the morning, and the chairman had a medical appointment he needed to keep, and we ended up with a number of the veteran service people from MSUM and Mayor Shelley Carlson, and we just put our own meeting together and had some discussions on services that are taking place out at MSUM. They really do a lot for their veterans out there, and some other issues that affected the group. Later that day, I attended a remote treatment court initiative advisory committee meeting. I represent AMC on that. We approved a Rice Mental Health Court. It passed on through our committee to the Judicial Conference for final approval. We discussed some of the mini grants that have gone out. Passed Carver County Drug Court. They have been operating a drug court for 7 years with a BGA grant which expired, and now they're being moved into the program as other counties have done. Discuss some confidentiality policies for the process of staffing during the specialty courts, and a performance measure process that's currently being worked on. And that completes my report.
Thank you. Commissioner Campbell.
On April 9th, let's see, yeah, April 9th, we had the Diversion Authority Planning Committee meeting. We spent the majority of the time, because we're nearing the end of the project, they're looking at having an October recognition event that's going to really go back and include people that have started working on this from the very beginning. Sounds like it's going to be quite a big event. That was where the majority of the conversation was in that particular meeting. We've had some follow-up. There was some follow-up done with the landowner complaint in southern Clay County. There seems to have been some progress made in that regard with the landowners and the Corps and the Diversion Authority, so hopefully there will be a settlement offer that can come soon that will be acceptable to all parties. I'm certainly hoping so. Then on that same day, later that day, I attended the Lakes Country Service Cooperative meeting in Fergus Falls. Not a lot new to report there. The budget is doing fine. We did approve cost of living adjustments and so on and so forth for the Lakes Country Service Cooperative employees. And I believe that concludes my report.
Thank you. Commissioner Bear.
On Wednesday, the 8th, I went to the Wild Rice Watershed District up in Ada, where they approved one Clay County permit for a culvert going in under a Keene Township road. They also discussed the road authority permits on who has to get permits, if it's state, county, and township officials. If they are just even replacing a culvert, same size, same length, they're discussing and who has to get those permits, if all three of those have to get those permits, or if they go, right now, they don't have to get a permit if they're replacing a culvert, if it's the same size and length, but they're looking at maybe asking them to start getting permits so then they can keep track of all permits in the district. And they are also discussing on following up on permits that they have given in the past and making sure they are done correctly. And then on the 9th, I went to the Clay County Soil and Water Board meeting where they approved 10 hay plantings in the county, that almost about 200 acres of hay plantings that they approved. They also have signed up some maintenance prescribed burns that will be done in April or May at the Crestwood site that the county owns. It's about 8 acres, and that'll be paid for by the Riparian Aid Fund that we have. That'll be our county-owned land south of Moorhead that they plan on burning off. We also talked tree orders. They put in an order about 14,000 trees, 10,000 are spoken for, that are supposed to be going out here in the next couple of weeks once it gets warm and dried out. If there's anything else at that meeting, Commissioner Krabenoff was also there at that one. And then last night, I went to the Ulen Township meeting and gave them an update on the county and the rural water project that we will be having a meeting and seeing in front of the judge on this coming Friday. So that is all my reports, Commissioner.
Thank you. Darren?
Thank you, Mr. Chair. I was out 2 of them, so I have about 3 weeks, but I'm going to shorten this up, so. Good point. Let's see, March 24th, I had a meeting with Steve on an upcoming grievance that I'll be handling today. On the 25th of March, I attended the Clay County Legislative Planning meeting, and on the 25th and 26th, started work on the 2027 budget. On March 27th, had some research I had to do on a question about healthcare savings plan contributions and para reporting. Also that day, I sat in on the PRTF meeting and had a personnel issue with a correctional officer that I had met with. On Monday, March 30th, did a wage calculator for detox, attended the Recorder's Office annual compliance meeting, had a meeting with Rory, reference our bandwidth, and found out that the state has increased our bandwidth because I don't know if you knew it, but our website was so slow. And now they've doubled our bandwidth, and it seems to be working much better now. And then also on the, that's all on the 31st, had a meeting with Mark Sloan, Mac Jacobson, and responded to a data request on April 1st. We had a Strive for Excellence meeting with the Strive for Excellence team. Attended the Clay County Legislative Planning meeting. Had a meeting with Lauren on payroll, and had a HR staff meeting. On Thursday the 2nd, I met with another correctional officer about some personnel issues. And the 3rd, 4th through the 9th, I was on vacation and sick leave. And then on the 10th, let's see, had responded to a data request response. I had a meeting with Corey and a Bureau of Labor Statistics report. I submitted that. Another note, I did attend the shotgun rifle issue remotely. AMC has been tracking where counties are, and right now, shotgun ordinance, there's 8 counties that have approved shotgun only. There's 47 counties that allow rifle, and there's 6 that are undecided at that point, just for reference. And just a reminder, on Thursday, April 16th, from 4 to 6, we have the Spring Rural Cities and County meeting in Barnesville Event Center. And that concludes my report.
I guess I forgot to include my report first, but I'll do that now. So going back to, we've made a couple of comments about the public hearing on the zoning, and again, that probably will be on the agenda for next week. On the Wednesday on the 8th, and that was one of my first 2 meetings I had last week regarding the PRTF and the non-secured. Things are with that really have taken off down at the Capitol. Commissioner Mojo has been down there. I think it was 2 days last week. She'll be there 2 days this week. And we've made a lot of headway in this regard. I think we had 8 more representatives join on as co-signers onto the bill. And we picked up Senator Hoffman, planned for today, which is really big. He's on the capital investment. And our lobbyists have just brought in people that we probably wouldn't be able to talk to as easily as before. So a lot of things that we put into place looked pretty frustrating in the beginning, and now I think as deadlines are approaching, things are starting to hone in, and hopefully we continue to be elevated toward the project. On the 9th, I was at the Class WCD meeting. Commissioner Bear did a good job on reporting on that. I really don't have anything to add. On the 13th, yesterday, I had my adult mental health executive meeting, working on our upcoming agenda and then planning for future meetings. And then last night I had the Buffalo Red and a presentation by River Keepers. They do a great job. Just a couple of highlights for the work they do. They're pretty well known around Fargo-Moorhead. Their work along the Red River. Last year they had 1,500 volunteers, mainly working around water quality monitoring on the river, both on the Minnesota and North Dakota sides, and water coming in and then on. Also, they Reforest the Red is another program they do. One planting along the Red in a specific area set up by the forestry departments. One would be in Fargo side and the other on the Moyd side. That involves 350 volunteers and 4,500 trees that they plant, so quite an undertaking. And then their annual event with the water festival with great elementary age kids. I think it's 4th grade. They had 1,700 kids for that event, 3 days, I believe it was. And then the rest of the meeting really had to do with a project that's Ditch 34, starts on County Road 2, just outside, right on the west side of Barnesville. Kind of meanders up for 1.5 miles and ends up on County Road 15th, an area we've had trouble with the ditch breaking out and that bridge that's on that road. Anyway, it's a project that has been in the making for a while. They've done their report on their findings, their engineer's report. They've described for the district, the benefits and the damages. Those were all approved last night by the board. And then they have set a date set a time and a hearing date for that project, which will be May 4th at 7 o'clock. The last thing that had some discussion, and it's very preliminary at this point, but DOT's looking over the next few years of doing the repaving and the reconstruction, roundabouts, other things on the I-10 corridor going through Dilworth. And in that area, that's how do they handle that stormwater? So there's a ditch 41 that follows the tracks east-west, just on the north side of the tracks, that goes toward Moorhead and then either goes north in a couple locations. And anyway, it's about bringing, when they do all this, it's going to potentially bring in another 40 acres of water storage into those ditch systems. So it's the beginning of the discussions. Are they going to need holding ponds? How are they going to do all this? It's at the very beginning, but they're just starting to work on that, and Houston Engineering will be involved in that reconsideration for anything to the watershed ditches. That's my report. Anything, Sarah? All right. Anything else, anybody? Brian, please? Okay. Hearing none, motion is adjourned.